What's going on, guys? My name is Abhinav. I'm a first year MD PhD student, and today I wanted to talk to you about the intrinsic eye muscles and a little trick that you can think about when you're getting your eyes tested at the eye doctor. So the intrinsic eye muscles. Intrinsic means that the muscles are attached to the eye in some way. There are a few muscles in this cavity that are not attached to the eye, and those aren't considered part of the intrinsic eye muscles, but they still might be ocular muscles. Just before I get into it, please do consider subscribing to my channel. It helps me out a lot. I post a lot of content about medical school journey as well as topics like these, topics that I learned in med school and I want to share with you guys. Helps me practice and also helps you guys learn. And do consider leaving a like on the video. So let's just jump right into it. I have a few pictures here describing the muscles of the eye. And there's a few muscles here. And don't get too overwhelmed with the amount of muscles here because it's actually not that hard to remember. Here's what it looks like in your actual body. Here's the front of the eye, the nose. So this would probably be the right eye. The ocular muscles, they're all going to be attaching to this common tendon back here, except one of them. This is at the end of that eye cavity, the posterior end of the eye cavity. And you can see the sphenoid bone here. And this is where your orbital fissures would be. The superior and inferior orbital fissures would be back here. And this is where your cranial nerves would go in as well as your ophthalmic neurovascular. So what happens here is that there's actually 4 different rectus muscles and 2 oblique muscles. So the rectus muscles are the muscles that have names that are very easy to remember. Superior, inferior, lateral, and medial rectus. And then you have a superior and inferior oblique muscle. So if we take a look at this picture right here, you have medial rectus attaching to the medial side of the eye, lateral rectus attaching to the lateral side of the eye. There's a superior rectus and inferior rectus over here. You notice how they're at angles. And I'm just going to show you a quick picture. I think it's a fake picture of the inside of the eye. So what we see here is that there's color coding for the arteries and veins and nerves and all that. But what happens is from that common tendinous arch, there are the muscles coming in at an angle, about a 45-degree angle or so, and they attach to the eye. The medial and lateral rectus, they attach pretty much medially and laterally on the eye. But the superior and inferior rectus, they don't attach directly on the poles of the eye. They attach a little bit at an angle. And same thing with the superior and inferior oblique muscles. So what you can see here is the superior and inferior rectus. They're a bit more medial, while the obliques attach a bit more laterally. And this is important for the functions of these muscles. The functions, they kind of do a little dance where some of them extort and some of them intort, some of them abduct and adduct the eye, some of them elevate and depress the eye. And I'll show you a little thing that will test each muscle independently based on the movement of your eye. So that's basically all the muscles of the intrinsic muscles of the eye. There is the levator palpebrae superioris right here that goes on top of everything and attaches to the eyelid. Palpebrae means eyelid. So this elevates the eyelid. And there are other muscles, obviously. For example, the orbicularis oculi over here actually helps to open the eye, close the eye. And well, what happens is that there's also this inferior oblique, which is somewhat, doesn't have an internal attachment. So what happens is that it does attach to the eye, but the other end doesn't attach to this common tendon right here. It attaches to the bony features of your face near the nose. So that also allows for different movement because it's not coming from this common tendon, meaning that its action is a little bit more different when you think about in relation to the other muscles. So instead of pulling back into the eye cavity, this one's pulling to the side. So let's move on to the actions of the extraocular muscles. Here's a little diagram testing each ocular muscle. And here's the right eye and the left eye. Everything in the right eye is the same as left, you just gotta flip it. So the letters right here indicate the muscle, so that's superior rectus, lateral rectus, inferior oblique, and the numbers correspond to the cranial nerve that's innervating that muscle. So what you can see here is that if this is the nose right here, where this medial rectus is. That's where the nose is. So if you move your eye towards your nose, you're testing your medial rectus. If you move your eye away from the nose, so that's abducting, that's testing the lateral rectus. If you move your eye towards your nose and then you go up, then you're testing your inferior oblique, down superior oblique. So this is kind of opposite because you're going up, but you're testing the inferior. But if you go laterally and then go up, you're testing the superior rectus, go down inferior rectus. So that makes a little bit more sense in terms of, okay, if you're going up, you're testing something superior, okay, superior rectus. So the only thing that's really flipped here is the inferior oblique and superior oblique, so the two obliques are flipped. And you could also see that you're also testing nerve function here, the cranial nerve function. So here's the mnemonic. SO4, kind of like sulfate ion, LR6, and then everything else, all others are 3, as you can see. So the 3 is the oculomotor nerve, LR6 is the abducens, and SO4 is the trochlear nerve. So by doing this test, you can test each muscle, as well as if there's any problems with nerves, you can test those nerves. So if someone has some sort of problem where they can't move their eye in a certain way, or the eye is going towards one direction, you can kind of rule out which nerves are damaged and which muscles are impacted. And obviously everything is flipped over onto the left side. So every time you go to the eye doctor, think about these muscles when you're getting your eyes tested. If they tell you to like look up into the angles to the side or down or whatever, you can be in your head like, okay, they're testing for these muscles. And obviously most likely that it's all fine, meaning that all your nerve function is fine and your muscles are fine. But these are very important to test because the eye muscles constantly are active. You might not even think about it. But going through all these motions will help decide if there's any problems with the eye muscles. So that's about it. That's the eye muscles, the intrinsic eye muscles. Please let me know in the comments below if I missed anything, and any other topics you want me to discuss in the future. I'll be happy to do it. And with that being said, I hope you liked it. Please do like and subscribe. It helps me out a lot, and I'll see you next time.